Good afternoon, everyone. I want to thank everybody for joining us. Just to let everybody know, I've got joined today by Dr. Kathleen Toomey, General Tom Carden, GEMA Homeland Security Director Homer Bryson, our Insurance and Fire Safety Commissioner General John King, and our Department of Community Health Commissioner Frank Berry will be available today for questions if you have them. Before I begin the weekly briefing, I want to provide a quick update on the Ahmaud Arbery case. As you know, over the past few days there have been several important developments. As many of you know, the Georgia Bureau of Investigation officially became involved in the case on the evening of Tuesday, May the 5th. Less than 2 days later, on Thursday, May the 7th, Gregory and Travis McMichael were arrested for felony murder and aggravated assault of Ahmaud Arbery. Both men are currently jailed in Glenn County. On Friday, May the 8th, that would have been Ahmaud's 26th birthday. Georgians from all across our state ran 2.23 miles to celebrate his life and to draw attention to the case. As you can imagine, this has been a very emotional time for our state. Our prayers remain with his family, loved ones, and the community as a whole. There are many questions that have yet to be answered, and frankly, Georgians deserve the truth. Attorney General Chris Carr announced yesterday that Cobb District Attorney Joyette Holmes will lead the prosecution. He also urged the Department of Justice and GBI to conduct an investigation into the process that delayed justice. I hold great confidence in Joyette Holmes, state law enforcement, and the Department of Justice. It is my belief that truth and justice will prevail in Georgia. A key part of our plan to ensure a healthy and prosperous future for our state is contact tracing. With nearly 250 staff in the field today, the Department of Public Health is making progress. Under the leadership of Dr. Toomey, DPH plans to have 1,000 staff deployed in the weeks ahead. To streamline contact tracing across the state, we are rolling out a new online monitoring tool, the Healthy Georgia Collaborative, which will allow Georgians to identify contacts and monitor symptoms. Health data will remain completely confidential. This monitoring tool does not collect any data other than what was entered by the contact. This is how the process is going to work. Residents who test positive for COVID-19 will be contacted by trained public health staff who will work with that individual to recall anyone they might have had close contact with while infectious. Those contacts will then be interviewed by Department of Public Health to help us map and isolate the spread of COVID-19 in communities across our state. If you are contacted by DPH staff, I want to strongly encourage you to participate in the contact tracing program. We need your help to defeat this virus. Together, we can continue to take measured steps forward in the days ahead. On April the 20th, I issued an executive order to reopen certain businesses that were shuttered during our statewide shelter in place. I'm very proud of these hard-working Georgians for following the guidance, keeping both their employees as well as their customers safe. I also stand with the small business owners and others who decided not to reopen their doors. These men and women have a choice, and I appreciate the incredible challenges that they face every single day in this environment. Today, I've issued a new executive order to extend several provisions, clarifying existing guidelines for certain businesses and providing guidance to other operators in our state. This order is issued as COVID-19 positive hospitalizations, ventilator use, and percentage of positive cases continues to drop. It is based on data, science, and the advice of public health officials. Many have warned of a second wave, and asks if we are willing to change course if conditions decline. Let me be clear, we will continue to track the numbers and continue to heed Dr. Toomey's advice. We will take whatever action is necessary to protect the lives and the livelihoods of all Georgians. In light of this new executive order, live performance venues, bars, and nightclubs must remain closed through May 31st, 2020. I know this extension is difficult for many Georgia business owners in communities that have music venues. However, we believe that waiting a little bit longer will enhance health outcomes and give folks the opportunity to prepare for safe reopening in the near future. All Georgians must continue to follow social distancing, and gatherings of more than 10 people remain banned unless there is at least 6 feet between each person. The gathering ban applies to all non-critical infrastructure businesses, local governments, and organizations of all types, including social groups, informal get-togethers, and recreational sports, just to name a few. We continue to strongly encourage people to wear face coverings when out in public, and we thank everyone for their willingness to do the right thing. The shelter-in-place provision for the medically fragile Georgians, age 65 and older, remains in effect through June the 12th, 2020. Mandatory restrictions for sanitation and social distancing will remain in place for all non-critical infrastructure businesses and for recently reopened businesses. We are extending the industry-specific restrictions that we have had in place. Those will remain in place through the end of the month. As businesses slowly reopen in some enhanced capacity, we know that many are safely returning to their place of employment. While returning to a new normal is exciting, the current guidelines make it difficult for parents to find childcare for their children. This new executive order will increase the number of people in a single classroom of a childcare facility from 10 to 20 people, so long as the staff-to-child ratio set by the Department of Early Care and Learning are also maintained. We are told by the Department of Early Care and Learning and Public Health that this expansion can be done safely and allows for more facilities to be able to reopen. Child care facilities must continue to adhere to 13 minimum mandatory criteria to be able to operate, including strict screening procedures and sanitation mandates for frequently touched items and surfaces. In that same vein, countless families have reached out to my office to discuss how summer camps can safely operate as we battle the spread of COVID-19. Working closely with the Department of Public Health, constituents, as well as summer camp operators, we have developed strict criteria so that these camps can start planning now to reopen with safeguards in place. We are hearing that the Centers for Disease Control and Prevention will be issuing guidance soon. When that happens, their guidance will control. But until that time, we will put out guardrails so people can begin making plans. We have defined summer camp as any entity offering organized sessions of supervised recreational, athletic, or instructional activities held between typical school terms, including entities commonly referred to as day camps. Starting May 14, 2020, summer day camps are allowed to operate if they can meet 32 minimum mandatory criteria. These requirements are extensive and cover a wide range of operations to ensure the safety of camp workers and participants of all ages. Even though we have these measures in place to allow for summer camps, we are not allowing overnight summer camps in Georgia at this time. We will continue to watch the data, keep a close eye on compliance, and make a decision make decisions based on a case-by-case basis when Dr. Toomey and the Department of Public Health determine it is safe to resume overnight camping or campers. Throughout this pandemic, our restaurant owners and their employees have done a remarkable job in keeping local families fed. These hard-working Georgians have followed the rules, doing the right thing, even when, quite honestly, it wasn't very easy to do so. In our new executive order, we are taking another step forward, empowering restaurants to expand operations safely only if they choose. Moving forward, we will allow 10 patrons per 300 square feet of public space in restaurants and dining rooms, and increase the party size per table from 6 to 10 people. For gyms and fitness centers, we have made some minor revisions to the mandatory criteria, all based on public health guidance to allow for enhanced flexibility. But strict social distancing and sanitation rules will still apply across the board. This crisis, as you know, has been an unprecedented challenge for state government. Agencies have met this challenge and continued to provide critical services to the people of Georgia. I'm proud to the thousands of state employees who have done an incredible job teleworking and adapting to the new normal. To ensure that quality of service continues, starting May the 18th, specific divisions of state agencies will begin to phase back into limited in-person operations. In my executive order, I have tasked the Department of Administrative Services with promulgating guidance for state agencies to safely reopen their offices. As we work through this process, we will issue that guidance to employees, contractors, and constituents. We will be making more detailed announcements in the coming days on how we will be phasing into limited in-person operations at state agencies. I'm very thankful to President Trump, Vice President Pence, the Coronavirus Task Force for their leadership as we continue to fight the spread of COVID-19. As of noon today, Georgia has received our first shipment of remdesivir from the federal government. We have received 30 cases with 40 vials of the drug per case, and we will be working with officials in the Department of Public Health to determine how it will be distributed. We also deeply appreciate the equipment and supplies that we have received from the Trump administration, including our May shipment of testing supplies. We had a great call yesterday with the Vice President, as well as many governors from across the country, and we certainly look forward to working with all of them in this continued partnership. During that call, the White House issued a call to action encouraging states to aggressively test nursing home residents and staff over the next 2 weeks. Thankfully, we've been doing a lot of that here in Georgia for several weeks, compliments of the Georgia National Guard. I certainly want to thank General Carden and his troops for a job well done. As of today, they have tested 46% of nursing home residents and 24% of the staff at those facilities. We estimate that there are 46,000 people who still need to be tested. In total, the Guard has tested 142 nursing homes, and they continue to move forward like they have with their infection control mission until that mission is complete. Speaking of testing, I did want to mention again that testing is available to all Georgians, regardless of whether you have coronavirus symptoms. Anyone can call their local health department to get scheduling for a test. They can also download the Augusta University Express Care app, visit augustahealth.org, or call 706-721-1852. Staff will schedule your visit to one of our 105 state-run testing sites around Georgia. The percentage of positive cases for COVID-19 continues to drop even as we ramp up our testing, which is certainly an encouraging sign. But here are a few things that everyone needs to know about the data as we move forward. Many healthcare facilities and labs are not reporting negative test results to the state. We are working with them to get this data collected and published. And also, as we aggressively test more nursing homes and long-term care facilities, we may see a sharper increase in positive test results. However, by doing this, it will allow medical providers to intervene earlier and try to mitigate adverse outcomes among the most vulnerable of our citizens. Right now, nursing home, assisted living, and personal care home residents and staff make up 18.5% of our positive cases, and 49% of the total deaths involve nursing home, assisted living, and personal care home residents. We ask everyone to continue to protect the elderly and the medically fragile as we continue to work around the clock to ensure quick, convenient testing is available for all Georgians. Before I end this briefing, I want to emphasize a few points. Every day we are seeing reports that more and more people are holding off important medical screenings and vaccinations out of fear of exposure. Yesterday evening, I read a Wall Street Journal article that new cancer diagnoses have decreased a staggering 30%. Please do not risk your health by delaying important appointments or treatments. Medical providers and healthcare facilities are open and they have safeguards in place for their patients. I also want to renew the call to action for all Georgians to heed the advice of public health officials, avoiding large gatherings and helping slow the spread of COVID-19. Your cooperation is making a difference in saving lives. Finally, I want to give a shout out to two hardworking Georgians who have continued to work tirelessly to help us keep everyone informed through this pandemic. Aaron Shoemaker and David Cowan report for duty to provide American Sign Language interpretation for deaf and hard of hearing Georgians at a moment's notice. Their efforts are vital as we work together to stop the spread of COVID-19 and to put Georgians back on a path to prosperity. So Aaron and David, thank you so much for your tireless work during this pandemic. And with that, I'll open it up for questions. And as I said, we have General King, General Carden, Director Bryson, Commissioner Frank Berry, and Dr. Toomey available too if anybody needs them.
Governor Kemp, thanks so much for this. Question for you, how concerned is Georgia in terms of folks from other states coming in, and what's being done to sort of manage that, if anything?
Well, I'm not overly concerned about that. I know that's been an issue kind of early on when there was a lot of air travel. Certainly that's been drastically cut. I think most of our visitors that are coming to the state are well educated like Georgians are. They're complying with the rules. Obviously, if they're going into our businesses that are open or enjoying our beaches or our state parks, they're having to provide by the rules. And from everything that I've seen and heard on our daily and weekly calls with law enforcement personnel, public health officials, we haven't really seen any issues with that. And I certainly would encourage all Georgians to stay and vacation in the state of Georgia, but if they decide to go somewhere else, I would ask them to take these best practices that they've learned here and use those in other states, and certainly follow the orders of my fellow governors wherever they may travel.
And real quick, Dr. Toomey had a question about data reporting. We looked at the Department of Health website, and I believe the first death now shows the death in Georgia was March 5th, not March 12th. Can you elaborate a little bit about that? Because I think when we first reported it was March 12th. The website now says March 5th. So we just wanted some clarity on that.
No, and I'll have to get back to you exactly what that change is about. We have been working to update and increase the capacity of our website and to allow to have it be more visually impressive and easy to access. And I'll have to ask the webmasters as to what might have led to that change, because I honestly don't know.
Thank you.
Governor Kemp, thanks for taking time to speak with us today. Tyreek Lynn with Tyreek on the Move. My question to you is, since things are reopening, more people are, deciding to come out, and you said that everyone can get a test. What are some new goals right now that you have in store for the next coming weeks?
Well, I think, we still have to just get the troops on the battlefield, if you will, for contact tracing. That is something that I've also charged Dr. Toomey with. That's what she's been doing for, I guess, almost 40 years now, and she knows what to do. She's hiring the people to do it. I think we have a lot of resources available to us with great, hardworking people in the state of Georgia that are willing to help us with that. We're also, we're doing this now in all 18 public health districts, so it's not like we're going to do this in a few days. That's actively going on now with around 250 people. We're also implementing the technology piece of that, it's not something we can just flip a switch on and it'd be working, everywhere, but that's in the field, and I'm sure that she'll be giving us more updates in the days ahead about that. But I feel much better about where we are on that piece. And then we got to continue to stay focused on any potential hotspot. I think a good example is, I was in Albany a few days ago looking at the mobile hospital unit, and I mentioned down there in Albany that I felt like Hall County was an issue that we were concerned with at the time, and there was a lot written about that being Georgia's next hotspot. The numbers there are really starting to flatten, potentially go in the right direction. General King has done a tremendous amount of work working in the Latino community up there to raise awareness about the virus. Dr. Toomey has been up there working with the local public health officials. We've engaged the business community, the elected leadership up there, the community leadership, the neighborhood leadership where the spread was happening, and it was a fairly contained environment. And so really through those processes and that work that we have done, dealing with the Albany situation and other places like Upson County and Carrollton and the Rome and Cartersville area, we were able to jump on that very quickly. We're not out of the woods yet. We're continuing to throw a lot of resources up there, including sending temporary medical personnel up there to help with the hospital. But we're in really good shape up there. We got to keep hunkering down up there. And I know General King is going to be up there again Friday, and there's just a lot of good things going on. So we have to continue to focus on areas like that, or if we have any other areas that pop up. And I think we're in a great place to do that now because of the hospital bed capacity, the number of ventilators we have. I was talking to Director Bryson this morning about our PPE supplies. The one thing that we were concerned with was surgical gowns. We're seeing that market free up, so we're in really good shape, I think, on PPE right now. And so we're just in a good place. We just want to keep these numbers moving in the right direction.
Thank you. Governor, how does the state plan to distribute the remdesivir?
Yeah, I don't know if Dr. Toomey might want to add something to that. I mean, we literally just got it today. Public Health is working on the protocols for the distribution. I believe there's some federal guidance with that on you know, the people that get it, how they have to deal with it and report to help with the clinical part of that. I don't know, Dr. Toomey, do you want to?
I just very quickly say we'll be pulling together a team to look at this, including health directors. We want to ensure that hospitals, particularly those hardest hit, have access to this drug. It will go to hospitals, it won't go to other providers. And so we want to create a consistent algorithm that will be the most fair and provide the most impact in those hardest hit areas, as well as those smoldering areas that continue. And so we'll get that out, we hope, in the next day or two.
And Governor, just to be clear, on long-term care, will owners of these facilities be required to have their residents tested?
Well, we're talking about, I think, nursing homes specifically. So our charge is to test them. You know, if the owners don't want to participate in that, I think that would be something I might let Commissioner Berry speak to, or perhaps General Carden. Frank, do you want to mention how that would work?
Thanks, Andy. It's very difficult for us to force people to do that, so it's highly encouraged. We've had great conversations with the Nursing Home Association. I think we will get a tremendous amount of cooperation with that. Unless there is some federal mandate that forces them to comply, I don't believe that we can force them as a state. But hopefully through the cooperative agreements that we have in place now, they'll be willing to do that. Thank you.
I would just mention too that we've had great conversations with the association, and they are really working with us on the situation, and we're grateful for that.
Governor, as you were speaking, the Speaker of the House sent out a memo saying the session will start in June. My question is, with a multi-billion-dollar deficit, a hole in the budget, are you willing to consider tax hikes, fee increases, other than budget cuts to help fill in the gap?
Well, I don't want to get into the specifics of what might be legislative during session. That'd be something that has to start in the House, and there's a lot of issues that being thrown around. You know, what the General Assembly takes up, I wouldn't want to speculate on that. We're continuing to work with the appropriations chairs every day, really watching our revenue numbers and what that's going to look like in the next couple of weeks and as we get toward the end of this month. But I would just say, from a budget perspective, my priorities are going to be the same they were the last press conference. You know, supporting our educators, continuing to stand up for our hardworking teachers. As we come out of this really tough economic situation that we're going to have, an educated Georgia from a workforce perspective is going to be as important as ever. Obviously, we've got to continue to put a focus on health care in our state, and I think we have all seen how important public safety is in our state, and that is where my priorities have been and where they will continue to be. And what that looks like with the numbers and the revenue and what happens with the federal government and potential new guidance for the CARES Act, or if there's a fourth stimulus, I really wouldn't want to speculate on that at this point.
Hi, Governor Kemp. Hope Forward with 11 Alive. What would you say to members of the community who are hoping for a discussion about a hate crime law in Georgia following the death of Ahmaud Arbery?
Well, I'd say, you know, first, anything legislatively, we continue to look forward to working with the General Assembly on whatever that is. You know, there's all kind of bills that are out there in play right now, the hate crimes legislation being one of them. I know that the Lieutenant Governor and Speaker have both been talking about that, and we look forward to working with them on all things legislative on June 11th.
Thank you.
Governor, I was wondering if you could, if you or Commissioner Toomey could give some more details about contact tracing. Can you give us any idea of, are all new cases at this point being contact traced? And if not, what share are being traced? And can you give us any idea of what kind of capacity we have each day to trace cases?
I'll let Dr. Toomey speak to that.
Yes, thank you. we're incrementally increasing our capacity every day. I mean, virtually every case in a nursing home, every case in a high-risk situation has been contact traced. So it isn't as if this is new. This is something that has been done. What is new is the tracking of it with the app and the capacity to expand and improve our ability to have the data to actually identify how many contacts per case. We have a number of people on board. As I mentioned before, 250 of our own staff deployed, several hundred students. But by the end, by June 23rd, we will have 1,000 people working on contact tracing. So we've been able to ramp that up that quickly. We have training capacity already. We've been able to get 2 staff from the CDC Foundation. So they've hired them and placed them to help us with the deployment as well as the training, 2 additional staff, as well as several epidemiologists to oversee the process and additional contact tracers as well. We are developing videos, and I hope in a future meeting, not only can we perhaps show the videos at one of these press conferences, but actually demonstrate the app to show how that works. And so I can't tell you, is every single case is being interviewed, and every single case is being asked about contacts. We just rolled out this app throughout last week, so it's fully deployed throughout the state. And we will be providing that data on an ongoing basis as we move ahead, but we will have more and more contact tracers, which will give us more capacity to do not only just these interviews and follow-up, but what I talk about, social networks, being able to look more broadly at some of the networks where people have been exposed and be able to do more aggressive intervention and education in the community. I think one of the most important things we can do, not only through this, these video education materials that we are developing, is also working with specific communities, because it's so critical that communities understand why we're doing this, why it's important to cooperate with us and to engage community leadership. We're looking to find champions for this in various communities and among celebrities and others that are recognized to help us let people know that this is important. This is not something that is a negative. This isn't government tracking you. Our app is not one that monitors your every move as you go through waves or as you're driving around. What our app is just designed to do is to allow our staff to monitor people without them having to call, so they can just enter daily their temperatures, how they're feeling, and to expand the capacities. But we have been able to move so quickly in this. I think the first time we talked, it was just a few weeks ago. I think you're a little skeptical when you and I talked about being able to get this many people on board this quickly. And there has just been tremendous response to the application process, both from these student interns, from our own staff, and then from the website job announcement. And so we can comfortably say we'll have 1,000 and the capacity to get more beyond the middle to late June.
Thank you.
Mm-hmm.
Good afternoon. This is a question for you, Governor, and Dr. Toomey. Today, Dr. Anthony Fauci, who was testifying to a Senate committee, said that the nation would not be ready to would not have a vaccine ready when schools are set to reopen in the fall. And despite that, Chancellor Wrigley was quoted today saying that they're still going ahead with plans to reopen all schools, all University System of Georgia schools, as well as moving ahead with beginning that opening over the summer. Are you confident that students will be safe when they return to school in the fall? And Dr. Toomey, are you also sharing the concerns of Dr. Fauci that we could see an inevitable second wave, as you alluded to earlier, Governor?
Well, look, I'll say I've spoken with Chancellor Wrigley. He's working very hard on a lot of different plans on what that would look like to have students back on campus. I certainly know that my prerogative would be for that to happen. I know there's a lot of parents around the state that want to see that, and at a multitude of ages. What that looks like is something that we're working on now. I know Chancellor Wrigley's been working very hard with the presidents of the system to see how that would look, to see how you can protect especially the most vulnerable, and then what are the requirements going to be for the students and the professors, and I think that's all something that's working. But we're not like the only state in the country that's doing that. I mean, there's people, I think, going back to school already in other states in the country. I think Purdue University announced that they're going to be having in-person classes, so I don't think this is anything out of the normal. I'll let Dr. Toomey speak to this, but from my perspective, we'll continue to follow the data. We'll continue to follow the advice of public health officials and these best practices on, how we can stop the spread and slow the spread and prevent spread in a campus setting, certainly in a classroom. And Dr. Toomey and I have had discussions on, what it looks like in a dorm type environment. But those are, early on right now. But I don't know, Dr. Toomey, if you want to add something to that.
I think the other thing I wanted to add is that we are looking not only at the data, looking at trends, but actually looking at hotspots and trying to get on top of those very quickly, and identifying those hotspots and then intervening very, very quickly on top of that to ensure that there's no further spread, so that a hotspot doesn't become a progressive trend in a community. But the most important thing we can do is to continue to talk about social distancing, to continue to talk about the importance of wearing a mask when you go out into public areas where you can't social distance well, and to continue to say this isn't over. We have to continue to follow those guidelines. And when you're wearing a mask, you're protecting me, not just yourself, especially me, not yourself. And I think that's something that still a lot of people don't understand. So you'll be hearing me saying that over and over again. We can ensure that our state is safe as long as everyone continues to take responsibility for themselves, their families, and their communities as we move forward together.
Hey there, greetings, Governor Kemp, Dr. Toomey. It's kind of a political question, and I know you're not up for re-election, but we're less than 6 months away from the election. The Washington Post poll had your response at 39% approval to the coronavirus. Any thoughts on that?
No, I'm not too concerned about a Washington Post poll today. I'm concerned about focusing on two battles we're fighting right now. One, to stop the spread of COVID-19, and number two, the economic battle that we're in to bring our economy back in our state.
Thank you. And quick question for Dr. Toomey. So Dr. Toomey, I was talking with a doctor today who mentioned remdesivir, and I know the state is going to get more supplies. He said he and other doctors have had concerns about it, that it might not be effective or it might be even harmful in some populations, that there are many questions about it. What do you say to that as a medical professional?
Well, I think we will, before we fully deploy, we will learn as much about it as we can. What it appeared to do is shorten the length of the illness in hospitalized patients, which is good news. If it can mitigate some of the severity of the illness and shorten the illness, and clearly we will be very closely monitoring. But our own Emory University Hospital did some of those very trials, and we will be relying on their experience and their expertise to help us, even as we develop guidelines for how it's going to be used. So we would certainly not be recommending its use for anyone who was identified as being potentially at risk from that. And I just want to also reflect on the fact that I'm not an elected official, so I'm answering as a...
Right, that's what I'm saying.
No,
as a
I know,
medical
I'm answering as a public health, a passionate public health official.
Thank you so much.
Governor, the extended restrictions you announced on business today that run through the end of the month, do you intend for any or all of those to expire at the end of the month?
Well, I wouldn't be able to answer that question right now. We just implemented this today. So, you know, we're going to do like we did the last time we had the order. We're going to continue to watch the numbers. I think it's important for people at home to realize, and folks that are tuning in, that the data is always a couple of weeks behind. So we're just now really being able to dig into the data from the move I made a couple of weeks ago. You know, you have a pretty good feeling of where you think that data is based on other things that we're looking at every day, you know, besides all these different models and graphs and just the, you know, the day-to-day information on the Department of Public Health's website, which gives us a really, really good guide, especially the information that they're putting up every day. But also just, you know, I've had constant communication with especially Metro hospital CEOs and actually CEOs from all over the state, hospital CEOs from all over the state, and that data continues to look very, very good. So regardless of, you know, the number of new cases that we may be seeing in a day, if there's a, you know, a pretty heavy day or maybe not so heavy, but then you also see your critical care beds, the availability, I guess the critical care beds in use is going down, so it gives you more availability. Regardless of what some model or some graph or whatever tells you, it just tells you whatever's happening out there, nobody's going to the hospital because of it. And that's what we want. I mean, that's what we said early on, that the targeted response that we've had to be responsible, to be methodical as we, you know, moved into the restrictions, and now as we're methodical as we move out, we learned early on, you know, we've got to protect the vulnerable, the people that are most at risk. I think you're seeing in that in our testing now going to, you know, a lot of African-American communities, a lot of the nursing home facilities that are in South Fulton and other areas that are, you know, unusually susceptible to COVID-19, focusing, you know, General King and his team focusing in the Latino community up in Hall County. You know, that's where we got to continue to focus our efforts every day, as well as the testing in the nursing homes. You know, that gives us a good idea of what we're dealing with. But that was one reason we had in the remarks about if we start testing the nursing homes and we go into a lot of these type areas, you may see spike in our case numbers, but it doesn't necessarily mean that we've got, you know, some new hot spot. It's because we're focused on a vulnerable population, and we want to know if they're positive so we can help take care of that problem. We can help stop the spread and get resources to that community. You know, you could do otherwise. You know, you could go test in places that probably don't have a high probability rate and may make your numbers look better, but we're not focused on the numbers looking better. We're focused on the vulnerable populations to try to protect them, and that's why I made the call to all Georgians to help us to continue to protect those medically fragile persons and communities, as well as those in our long-term care facilities.
Thank you.
Governor, you also signed another executive order. I've just glanced at it about driver services. It appears to say that the students, the teenagers who took the tests, or sorry, didn't take the test but got the licenses must now take those tests, and they have until September 30th. Can you provide clarity on what it does and why you did it?
And that was always the case. We just wanted to clarify that. We had a lot of questions out there for that. So anybody that has gotten a driver's license that hasn't taken the test, even though they've, you know, met the criteria of so many hours on the road and been to driving school or had your parents verify that, they're still going to have to come back and take the driver's test.
And why is that?
Why is it?
I mean, why did you sign this additional executive order?
Just to make sure that was clear, because we had a lot of questions about that. We can follow up with you with some more information. I just signed that a few minutes ago. That was something that the legal team had sent over. All right, well, thank you very much, everyone.